has been my very objective. I know that, like in my case as a nurse, I've always wanted to help, but in some other ways, being a teacher and doing this, informing you. So hi, today I'm going to show you how to collect a sample from a urinary catheter. So I have here Andy Smith, date of birth 1st of the 1st 2000, has a short-term urethral catheter. A doctor has requested a CSU due to a positive urine dip. Please obtain the appropriate sample and send for microscopy, culture, and sensitivity. It is today and it is 8 in the morning. Let me begin this station with the 7 steps of hand hygiene. I've already washed my hands with soap and water. I will carry on with this procedure using a hand gel. Palm to palm, back of my hands, fingers interlaced, fingers interlocked, rotational rubbing of the thumb, fingertips, wrist. I'll let my hands dry. Assuming that scene safety and privacy have already been ensured, identity and allergy have been checked, procedure explained, consent taken, and pain and comfort already addressed, I'm now happy to prepare my materials. First, I will wear a visibly clean apron, now we will need a tray. This tray has already been cleaned with soap and water for the past 24 hours. I'm still happy to clean it with the clinical wipes. But first, let me just wear my gloves. From a box that's dry, intact, and in date. I also will be needing this clinical wipes. So I'll clean this tray with this clinical wipes that's dry, intact, and in date. Clean the tray from farthest to nearest using an S motion, including the sides as well as the bottom. I'll leave it to dry. Just throw this in clinical waste bin. Now, we'll get a pair of gloves from this box I've already checked a while ago. I need alcohol swabs that's dry, intact, and in date. You also need the sample pot that has the same information as the patient. So in the documentation, yes, it's for Andy Smith, 1st of the 1st 2000. We also need syringe, needleless syringe that's dry, intact, and in date, as well as the hand wrap. Now I already have all the materials ready. I just retained this apron for exam purposes. I'm now happy to go back to my patient. Hi Andy, I'm
Hello.
back.
Hi.
I already now have the materials for us to collect a sample of your urine from your urinary catheter. Are you still happy for us to do that?
Yes.
Alright, so I'd just like to check the catheter first, Andy, alright? Let me
Okay.
just wear my gloves. Is it alright if I just expose you a little bit?
Sure.
I'll just show the catheter. So I can see that the catheter is patent and there's free flow of urine. In cases that there isn't any free flow of urine or an ample sample of urine available in the tubing, I will make sure to clamp the tubing a few centimeters distal to the port. Wait for 30 minutes and I'll come back to collect the sample. And after I've collected the sample, I will make sure to unclamp the catheter. Now in this case, there is ample sample of urine in the tubing, so I'm happy to collect. So Andy, this is a painless procedure. I will just be collecting the sample from your catheter and I will be sending this to the laboratory for culture, microscopy, and sensitivity, all right?
Okay.
All right, let me just open this a little bit to prepare it. First things first, I would need to clean the sample port. After cleaning the sample port for 30 seconds, I will then have to insert the syringe, the needleless syringe, to the port at a 90-degree angle, and then I will aspirate for the desired amount. For this case, we would need at least 10 mils. All right? And then afterwards, I will transfer it to the pot using a non-touch technique, and then I will make sure to set that aside and then clean the port of the catheter before I go. All right? Is that clear?
Yes.
Okay. So first, I'll clean the port. So this is the sampling port. Have to clean it for 30 seconds. Let it dry for 30 seconds. I'll throw this in the clinical waste bin. I'll open the syringe. We're using a needleless technique. And then I will now be inserting the syringe at a 90-degree angle to the sampling port. And then we'll try to collect the right amount of urine. So I've already collected the right amount of urine, which is 10 mils. I'll just transfer it to the pot using a non-touch technique. And then I'll set this aside. I will make sure to send this sample to the laboratory within 4 hours. If not, I'll have it refrigerated within 24 hours. Now, I will throw this depending on hospital policy. This can be thrown in the sharps bin, and all the rest can be thrown to the clinical waste bin. Now, let me just clean the sampling port. I'll again clean it for 30 seconds. Allow it to dry for 30 seconds. And then, Andy, we've already collected the sample. Is it all right if I'll just cover you back?
Okay.
Just cover you back. So let me just discard things that I've used. So I'll throw everything to the clinical waste bin. Then I'll make sure the sample is sent. And I'll make sure this tray is clean and ready for the next use. So Andy, I've already sent the sample to the laboratory. We just have to wait for the results, all right?
Okay.
So the doctor will come and see you to explain it. Meanwhile, I highly advise you to take 2 to 2.5 liters of water in order for you to flush out the toxins in your body, all right?
All right.
So Andy, is there anything else that I can help you with?
No, I'm okay.
All right. If in case later on you need anything, here's the call bell. Press the orange button. I or my colleague will be happy to come and help you.
All right.
All right. Would you like me to open the curtains?
Yes, please.
Let me just open the curtains. And thank you so much, Andy, for your cooperation. I will leave you now. I'll end this station with the 7 steps of hand hygiene. 1, 2, 3, 4, 5, 6, 7. And let my hands dry.